Hello, in today's video, we'll be talking about a disease called schizophrenia. So, you are a nursing student who is just graduating nursing school. You just got your license and you got your first job as an RN. You are really excited that you got a job at psychiatric mental health facility and you are a psychiatric nurse. This is your first day at your job, and you walk onto the hospital floor and onto the unit. You see a patient who is standing in the corner, who is speaking with the television. He is saying something like, uh, FBI is wanting me, they are monitoring me through the TV, and I also used to be the head of the CIA. Then the patient looks at you and he starts walking towards you. As he's walking towards you, the patient is starting to make fists, he's starting to clench his teeth, and he is muttering some words that are not making any sense. He is jumping from one sentence to another without making any sense. He's saying something like, I am missing my mother, the breakfast was good, I don't like this place, I am the Jesus, I am the Messiah, and nobody can hurt me. And then he goes on to say some really mean and bad words towards you. In that situation, as an RN, what are some of the nursing assessments that you should be making? What are some of the key things that you should be looking for in this patient? And also, what are some of the nursing interventions that you can do to prevent anything bad from happening and to protect this patient and to protect yourself as a nursing professional? These are some of the things that we will be talking about in this presentation. Hello, my name is Rizwan Ali. I am a board certified psychiatric mental health nurse practitioner, and today's presentation is related to schizophrenia. So the objectives for this presentation are to define what schizophrenia is, what are some of the symptoms, what are some of the positive and negative symptoms, and then talk about some nursing interventions and use all this knowledge to go through a case study. So schizophrenia is psychotic mental disorder. Uh, it typically occurs in females in their late 20s or early 30s. In males, it's typically in the late teens to early 20s. Um, there is not a cure right now. However, medication and therapy can help manage symptoms of schizophrenia successfully. Uh, some of the causes of schizophrenia are related to genetics, possibly. They are also related to the environment, toxins in the environment, prolonged exposure to stress, depression, also abuse of some kind, and then trouble during pregnancy, and also use of drugs, illicit drugs, and specifically marijuana and other street drugs, to name a few causes of schizophrenia. Basically, it's an imbalance. It's an imbalance in the chemicals in the brain. Uh, to name a few are dopamine, serotonin, glutamate, and GABA. And we will go more in depth as we talk further. So, the key signs or symptoms of schizophrenia are hallucinations, which means to see and hear things that are not present, and delusions, which are false beliefs that are firmly held by a patient regardless of the proof that they are not true. Um, Also, disorganized thinking and thought process, such as word salad, and also non-linear thought process and disorganized behavior, uh, such as catatonia, which is not responding to any kind of verbal commands, anhedonia, loss of pleasure, lack of motivation, and reduced emotional expression are some of the negative symptoms of schizophrenia. So, again, the positive symptoms are mainly hallucinations and delusions. It could be disorganized thinking as well. And the negative symptoms are the ones that are not very apparent, is when the patient is withdrawn and is not willing to engage or participating in any kind of activities. Again, these pictures are depicting positive versus negative symptoms of schizophrenia. Positive, again, the patient is loud, he is boisterous, patient is saying things, and also he's verbalizing that he's hearing things. um, versus negative symptoms are patient is withdrawn and not responding and possibly catatonic. There are three to four types of schizophrenia. The main ones are paranoid and disorganized. Again, paranoid is when you have hallucinations and delusions about possibly persecution, or you have delusions like grandiosity, or also you believe that somebody's out to get you or people are monitoring you. Those are that examples of paranoid schizophrenia. And then we have disorganized type, where the patient is not able to have a logical conversation. Uh, they are not responding to verbal commands. They are withdrawn and not listening to what you're saying. So this is the patient that we were talking about in the beginning of the presentation. The patient name is John Doe, 24 years old. Patient was um, diagnosed with schizophrenia at the age of 19 and has history of multiple hospitalizations due to psychotic episodes, non-compliance with meds, and history of aggressive outbursts when experiencing paranoia. And this patient is pretty angry. Okay, so let's do some questions. So the first question for this presentation is, what are some of the potential warning signs that this patient with schizophrenia may become aggressive? So aggression or violent language, that can include curse words, it may not. Definitely it includes shouting at the nurses, shouting at the other patients, constantly walking or pacing back and forth, either towards you or in the hallway, clenching of teeth, making fists or punching the objects near them, or punching into the wall or the door. Typically, there are no doors on the psych ward, but punching into anything that's near them. And another one is if they are staring blankly at you and then they start walking towards you, you better believe it's time for you to walk away and create your distance from the patient, because they might get really violent. So, what are some of the nursing assessments you should be making as an RN when you have a patient encounter like that? So, make sure that you're monitoring. The patient has delusions. Uh, Patient is making remarks that somebody's out to get them. People are watching them. Patient is the Jesus Christ. Things like that. Uh, or is the patient saying that he is seeing his deceased grandma, who is saying for him to kill himself and others? Then most definitely the patient is having psychotic episode. A disorganized thought process or speech pattern is when the words and sentences the patient is saying don't make any sense, and the patient is confused as well. Withdrawal from social environment is when the patient is not participating in any kind of group activities, they're not getting out of their room, and they're not trying to communicate with you when you communicate with them. What are some of the interventions, nursing interventions by priority that you can take for this patient? So again, this particular question is asking about the scenario that we talked about in the very beginning of the presentation, that the patient is walking towards you and is very angry and he's muttering words and he's having hallucinations and he is delusional. So the very first thing is for you to medicate the patient, um, get help from other nurses, and get to patient's MAR, and look for any kind of antipsychotic, IM or sublingual medication if there is a standing order. Um, and second thing is to develop your safety plan. Develop safety plan for yourself as an RN, and also for the patient. Yeah, if the patient is saying they're suicidal and about to go hit their head in the wall, or in the toilet or something like that, make a safety plan that might involve getting the PCA involved to control the patient, or other nurses involved at that time. And then after that, collaborating with other healthcare professionals. So, calling the attending doctor or the nurse practitioner to inform them about the situation, and if there any medication changes that need to be made, they can make those at that time. And these other two at the end really apply when the patient is more stable. So when the patient is relaxed and he's at ease and he has calmed from that psychotic episode, then you can help the patient with their ADLs rather than the patient doing the ADLs themselves. And then encouraging the patient to start participating in the group activities, start participating in the therapeutic intervention, start participating in the therapy program itself. So treatment for schizophrenia is, the first line treatment is of course medications, and that includes mainly antipsychotic medications. Uh, there is first generation antipsychotic thorazine, Haldol, fluphenazine, clozapine. These are first generation, and if the patient is extremely psychotic and those medications are ordered, uh, you should definitely give those. Otherwise, the second generation antipsychotics such as olanzapine, quetiapine, paliperidone, risperidone, and abilify are also really good choices. That could be given IM or sublingually. If not, they can also be given by mouth. However, in an acutely psychotic episode, the by mouth dose may not work as efficiently and as quickly as the IM or the sublingual might does. And then the therapy is an important component of treatment for schizophrenia, specifically cognitive behavioral therapy. Cognitive behavioral therapy helps patients restructure their thought process, helps the patient be more grounded, helps the patient differentiate between the reality and the non-reality, and helping the patient uh, participating in the group activities, group therapies. Those activities are really important because they help the patient build social skills and resilience. From this presentation, some of the key takeaways are uh, to recognize how serious schizophrenia is. It's a debilitating mental disorder, and it has two types of symptoms: positive, which includes hallucinations, delusions, disorganized thought process, and negative, which includes loss of interest, feeling sad, not want to engage with anyone, and being withdrawn, to name a few. Again, nursing care focuses on safety, communication, medication adherence, and social engagement. Um, and then also we talked about some learning strategies for nursing students. And then we must understand that nurses are backbone of any healthcare team, and they play an important and crucial role in maintaining therapeutic environment, and making sure that they are safe and the patient is safe while taking care of the patient's well-being. All right, that's it, and thank you. Thank you for listening to the presentation. Have a great day.